Welcome, everyone, to the Onegevity Gut Microbiome Hopes, Fears, and Possibilities for the Employer. I have the distinct honor of introducing you all to leaders in the microbiome space, Dr. Patrick Hanaway. He has a vast background in integrative and functional medicine. He's board certified family physician. He served on the executive committee for the American Board of Integrative Medicine. And also, you may recognize his name for the work that he has performed with Genova Diagnostics and as a chief medical educator for the Institute for Functional Medicine. He was also an integral part of helping to establish the Cleveland Clinic Functional Medicine Center. In addition to Dr. Hanaway, we have Dr. Bodi Zhang. He's the chief science officer of Onegevity. He's a founding member of Onegevity and a former professor in pharmacology at Tufts University School of Medicine. He is a published chief science officer, and he speaks frequently at conferences. He's also a consultant to many pharmaceutical companies and businesses related to scientific development. So we're honored to have both of these guests here with us today. Dr. Hanaway, we would like to get started with you and just kind of understanding your perspective on the future of personalized health and what it looks like for employers.
Well, thanks, Sonia, for asking me to participate in this. And it is an exciting time that we're in right now in the field of personalized health, which I might separate from precision health. But personalized health is allowing for that individualization to go on. And we're at a point where we're beginning to be able to effectively aggregate data. We're looking at anthropometric measures of height and weight and bioimpedance analysis and percent of body fat, and being able to look at and gather that data digitally. We're looking at continuous glucose monitoring. We're looking at heart rate variability. We've got biomarkers that we're integrating into that, as well as measures of function. As we do that, we begin to also look at symptoms that people are having, and we gathering that data, we have the opportunity to really be predictive of what path that person is on. And one of the best tools that we have, and the thing that I'm most excited to talk about, is with the advent of metagenomic testing of the microbiome, we really have a gold standard that we can begin to understand really exactly where the person is at and the trajectory with which they're going, because the microbiome has an influence on just about every single kind of disease, and we can use it to predict where the person is in their journey of health or their journey of illness.
Would you say that we are closer to being able to develop further personalizing approaches to nutritional advice than we were maybe a year ago based on the information that the microbiome can tell us?
Absolutely. So the microbiome is going to give us the indication of where that person's nutritional status is. And we're now, through the use of artificial intelligence and machine learning, beginning to understand what the exact influences are on an individual's microbiome. And interestingly enough, it's different for different people. There's not a one size fits all. You can't just say Mediterranean or paleo or keto, and then that works for everybody. Really, you need to be able to individualize the recommendations based upon what the gut microbiome is. The data out of Israel shows us that to be true. The published papers demonstrate that. We can look at glycemic effects of foods based upon the microbiome and really personalize the recommendations that are going on. So we are in a great position to be able to do this. And it's fascinating to me. I was just reviewing and teaching, and I have a paper that I have included in my talks for 15 years from Dr. Jared Nicholson, saying the future of personalized medicine happens in the gut microbiome. And he said that in 2005, and now we're seeing it really be able to play out, not just in theory, but in practice.
So I think we all aspire to be able to deliver a personalized experience in an employer setting. Can you tell us more about, as employers are looking at chronic diseases among an employee population and that type of data, what's the correlation between, the ideal microbiome and what would an employer see in their population that may represent microbiome-related issues from a chronic disease standpoint?
Sure. Yeah, well, I think we have the opportunity to look at it in three different strata. Those who actually have these diseases like autoimmune diseases and diabetes and depression, those who are at risk for it. There's emerging risk that we can define. And then there are those who are in the general population who are wanting to prevent that pathway. So we have the capacity now through the microbiome and other biomarkers, to be able to identify exactly where that person is at and be able to make recommendations that we will then tailor to the individual, working with health coaches, as we've seen through the digital health revolution, nutritionists, physicians. We have the capacity to be able to set up programs that are leverageable and scalable, that are able to deliver these services to the at-risk groups and to the high-risk groups, being able to demonstrate a decrease in cost overall by helping move these people along that continuum from disease back towards wellness.
So you think it's possible to use tests like microbiome tests for employers to improve employees' conditions pertaining to like IBS, IBD? The intelligence from it could be helpful with employees who have autoimmune. Are there other categories?
Yes. One of the things that we're seeing with the microbiome is that every single disease that's been looked at has been shown to have some relationship to the microbiome, whether we're talking about neurodegenerative diseases or mood disorders, depression and anxiety, whether we're talking about things in the gut like irritable bowel syndrome or IBD, or autoimmune diseases, in the whole spectrum that goes from MS and celiac disease to thyroiditis to rheumatoid arthritis and lupus. So we've got great opportunities to be able to do that. And many of these diseases have their roots in the gut. So when the gut is out of balance, that means that the foods that the people are taking in are not able to be effectively utilized. So good foods, bad gut means problems. Bad foods, bad gut means problems. Bad foods, good gut still means problems, but we can identify that through the use of the microbiome testing and be able to then personalized target the interventions that we're going to use.
And since you've been, kind of surveilling this market for a number of years now, could you provide some advice on kind of how a layperson could observe microbiome tests that are out there? Like what should they be looking for as just a baseline? What kind of information should they expect to receive?
Yeah, I'm smiling. I first started looking at this 30 years ago and looking at stool culture and other metabolomic biomarkers to be able to do that. And I've used it in clinical practice since that time. And then we saw the advent of 16S RNA testing, some interesting probes that give us a window into what's going on, but those tests are not standardized and they're only giving us a fraction of what's going on. What we've seen emerging over the past 5 years is the use of metagenomic testing. That is, kind of a shotgun technique that's based upon what was done with the human genome 20 years ago. But it's more difficult because we have hundreds of different species in each of us, and we're all different. And there are thousands of different species that we need to catalog. But that's been done. And now we have the capacity to be able to understand exactly who is there and to be able to understand from a genetic standpoint what genes they're using. And so we can begin to understand what's being produced by those bacteria as well. So now we've got a very unique opportunity to be able to see what's going on in the gut, who's living there, and what they're doing. And that will help to drive a personalized recommendation, not only for nutrition and diet, but also for other kinds of supplements and support that will help to bring their gut back into balance.
Well, Patrick, I'm so glad that you referenced how long you've been watching the microbiome space and how you've been using it in your practice. I think that it seems to, for most folks, have recently hit, kind of a point of inflection. But for you and folks like Dr. Zhang, who've been following this industry for some time, you've really been able to hone in on 30 years worth of work and codify it for us in a very concise way. So thank you. We appreciate your layman's version of the microbiome.
Thank you.
Bodi, we'd like to ask you some questions now and just to gain a better understanding of longevity. Obviously, longevity represents many of the attributes that Dr. Hanaway just referenced as far as the capabilities of the microbiome test through the gut bio test. Can you tell us a little bit about longevity as a founder of that business and kind of what the goals are?
Sure. Thanks so much, Sonia, for having me here. And As Dr. Patrick Hanaway said, I mean, precision nutrition and personalized nutrition gradually become a trend. It's already widely accepted in the medical community that for pharmaceutical and also disease treatment, like personalized treatment is really the future. However, in the chronic condition management and also nutrition field, not many people do it right. The information here is largely fragmented and invalidated. So our mission at Onegevity is really, we want to bring this personalized nutrition concept into each individual's, consumers, patients. Our goal is by utilizing different kind of a test, we want to understand a human being way better and also provide a total personalized solution to really help them to improve their health and also manage the chronic condition. So with this mission, Onegevity, we partner with two top leaders in the field, Professor Chris Mason in Cornell University and Professor Joe Dudley in Mount Sinai School of Medicine. As you know that because for chronic condition management is a long-term process that involves a multi-dimension intervention, dietary, nutrition, lifestyle, even long-term medical management. So this tons of data really needs a large and strong backend artificial intelligence platform for data synthesis. So that's why the collaboration between the two professors at Onegevity to provide this platform is critical for us to really understand all the complicated information and also provide a multi-dimension intervention on the back end. So our goal really for here is we want to bring the testing platform to individuals, to doctors, and also eventually working with our partner company, our sister company, Wellness Effect together, and offer this as a solution to companies in corporate wellness setting.
And to really feed on what you stated, Bodi, regarding the goals of Onegevity and the mission to work not only with the consumers on an individual personalized level, but also with employers, because ultimately employers are the true payers of healthcare. Can you help us add a little bit more context to some of the language that's used around microbiome testing? I've got a slide here that kind of illustrates 16S, 18S, and kind of without getting too far above our heads here, but can you guide us on why Onegevity made the investment in the technology that they did and how that improves the information that the consumer and ultimately the employer would have access to?
Sure. So number one, talking about the technology, I always believe that the technology always needs to serve the needs. But why we need to do a test on this and how this test can really help our consumer and also doctor eventually. The goal for here is the test should really address the condition for the patients, help understand what's the problem with the gut, and eventually provide an actionable plan. So that's why after looking at the field carefully, with the help from Dr. Patrick Hanaway, we really think metagenomic-based sequencing tests provide the needs we want here. Compared to a last generation testing like 16S-based test, metagenomic-based tests not only provide you what bacteria or what potential pathogens in your gut, they also will be able to tell you the function through the gene sequencing. This is particularly important because only knowing what bacteria you have in the gut is not enough to really for us to form an interventional plan. We also need to know what those bacteria interact with each other, what potential small metabolites or molecule produced by those bacteria, and what potential damages they can generate to the gut. And this cannot be achieved by 16S-based tests and needs to rely on metagenomic-based sequencing. That's number one, we choose this test. And number two is on the test that you can see, there's also many functional tests in the field that require dry shipment and also require large quantities of samples. Because this test is offered really for long-term chronic condition management and also for lifestyle management, we also have to consider about customer experience. Because if a test or a service that requires a lot of customer attention and are not user-friendly, the compliance will be a long-term problem for both the company and also the individuals. And for metagenomic sequencing tests at this stage, we'll be able to do that with a fairly small amount of samples and with no dry, just room temperature shipment, which bring a really nice customer experience into the field. Based on our previous historical data, the overall compliance for the test is more than 80%. So we believe with this high compliance rate, this can be a really powerful tool we can use for both company employee management and also for individual health management.
Well, engagement is a huge concern for employers, especially when they're invested in an employee's health. So it's exciting to hear on a test that's not the easiest test to get back, but you have an 80%, compliance rate. And I love that you've been so thoughtful about that experience and using a sample size that is obviously enough for you to, draw the accurate information from the sample, but also be conscious of what the experience is like for the consumer. So I certainly appreciate that, and I'm sure employers are impressed by the engagement level of employees on a test like this. As you're thinking about the microbiome and what you've learned so far from Onegevity, are you able to tell us a little bit from an employer perspective, the types of employees or the types of addressable chronic diseases that you think this type of test would be helpful in supplying information to an employee on how they can improve their health?
Sure. So as everybody knows that digestive disease or digestive condition is a major health problem in the country. So we have estimated about 70 million people have more or less different level of digestive problem. Either it can be a celiac disease, IBD, or it can be a mild condition like IBS or like occasion gut problems. So 70 million people, that's more like combined with diabetes, depression, and COPD. So from an employer perspective, this becomes a really big health burden from many perspectives. Number one, obviously, there's a health claim, especially for self-insured company. This health claim will definitely generate a financial burden for the company. And number two is we see the productivity and also leave on absence because of the condition or disease or symptom. This can also be an issue for the companies to consider. That's why we think by offering the test and also our personal nutrition intervention, we'll be able to, number one, reduce the people who really have to report a health claim or they have to see a doctor eventually for their disease condition. And number two, also increase productivity to make employees like health or quality better, and also increase attending time and also make the productivity higher. That's why I think from an employer perspective, this platform provides particular value to improve the company productivity and also at the same time improve their overall employees' health condition.
And so you believe that there is a correlation between the recommendations that are offered through the gut biome report to employees, that if those recommendations are followed, the employee has an opportunity to make some nutritional modifications or lifestyle modifications and in fact be more productive at work and potentially save the company, money in their health claims?
Yep. We actually run a small clinical research before we have these products available. And in the clinical research, using our personalized nutrition platform, we actually improve 80% of the participants' gut condition, and 40% of participants reported a complete improvement or relief for their gut symptoms. That's why we're very confident based on our scientific evidence and our clinical evidence, this platform brings particular value to reduce the symptom and increase the life quality for employees.
Very good. Well, we appreciate you answering the questions. The questions that I asked today were also fed by some of the other participants on the line. So thank you all for sending in questions. We will provide this recording in hopes of answering more questions for you all in the future regarding the microbiome. So thank you both, Dr. Zhang and Dr. Hanaway, for participating today. And we appreciate you all providing us with this microbiome update and also presenting it in a way that the average person can understand it.
Thank you, Sonia. Thank you, Bodi.
Thanks, everybody.